heart channel of hand Shaoyin. The heart meridian starts at the mid-axilla, anterior to the axillary artery. According to the classics, this is a forbidden point for needling, but in case one needs to use it, a compromise point at the end of the anterior axillary fold could be used. The meridian flows along the medial ventral side of the arm on the palm and ends at the radial corner of the nail of the little finger. The interior part of the meridian originates from the heart, as you can see on the figure. It also enters the small intestine, the coupled organ. The upper part of the inner branch runs up to the larynx and further on to the eye and brain. Heart 1 is located with the arm abducted in the center of the axilla, anterior to the axillary artery. This is the first and the entry point of the heart meridian, as it receives energy from the previous spleen meridian. If it should be needled, a point at the end of the anterior axillary fold could be used. Then we have heart 3. Heart 3 is located with the elbow flexed at a right angle. This is in a depression between the ulnar end of the transverse cubital crease and the medial epicondyle of the humerus. This is also called the laughing point. Heart 3 increases heart yang. It is the water point and the grandmother point of the channel or meridian. Heart 4 is located 1.5 chōng proximal to the transverse wrist crease on the radial side of the tendon of the flexor carpi ulnaris muscle. Heart 4 is the metal point of the heart and could be used to sedate heart yin as well. Heart 5 is located 1 chōng proximal to the ventral wrist joint space, the most distal transverse wrist crease on the radial side of the tendon of the flexor carpi ulnaris muscle. Heart 5 is the luo connecting point of the meridian, used to tonify the yin and reduce the yang. It is a very good point to treat stammering. Heart 5. Good for mental restlessness, hoarseness of voice, and chronic insomnia. Heart 6 is located 0.5 chōng proximal to transverse wrist crease on the radial side of the tendon of the flexor carpi ulnaris muscle. Heart 6 is the she-cleft point of the heart. She-cleft points are generally used in acute and urgent situations of the organs. And this could be used in anxiety, excessive sweating. We are reluctant to use this point in minor problems such as sweating, but it could be suitable in angina pectoris. The author is more comfortable using pericardium 4, which is the she-cleft point of the pericardium. In every instance that using the she-cleft point of the heart is required, so that we do not over-sedate the heart. Heart 7 is located on the ventral aspect of the wrist joint space, the most distal wrist crease, radial to the insertion of the tendon of the flexor carpi ulnaris muscle. Heart 7 is the yuan source point and sedation point. It is an excellent tranquilizing point called Heaven's Gate. When heart 7 is sedated, it would sedate more of the yin than the yang. So we should be careful not to use this point if the heart yin is too low. Points heart 4 to heart 7 are all on the radial side of the flexor carpi ulnaris tendon, and starting at point heart 7 at the distal wrist fold, they are 1/2 chōng proximal to each other. The problem in most practical sessions has been to locate the distal wrist fold exactly. This should be the most distal and full fold away from you. If this is located incorrectly, then every time you wish to needle point heart 7, you will be in point heart 6. And heart 4 will be given instead of heart 5 and so on. Remember, it is not the intention that gives results in acupuncture. The points give results. Now let's talk about heart 8. This is located on the palm between the 4th and 5th metacarpal bones. Heart 8 is the fire point and the house element point of the heart meridian. It is extremely effective in tonifying heart yin. One of the best points in the treatment of gallbladder meridian headaches. It is important to improve memory and sleep. So remember heart 8. And finally, we have heart 9, located on the little finger, point 1 soon, lateral to the radial corner of the nail. Heart 9 is the tonification point and the wood point of the heart. A very good point in the treatment of performance anxiety. It increases mostly the heart yin and some yang. Heart 9 is not very suitable in the treatment of insomnia, as the increased heart yang would make the patients more restless. Heart 9 is the last exit point of the meridian before it flows into the small intestine at point SI1.